As cases of COVID-19 infections decline in the country, many Nigerians have become more relaxed in their response to the coronavirus, and some have totally abandoned safety protocols. But the Nigeria Center for Disease Control and the medical professionals are warning that lax adherence to safety protocols, especially with the resumption of schools across the states and resumption of international flights, could pose terrifying consequence for the country. For the Director General of NCDC, Nigerians must take personal responsibility to avert such scenario by strictly abiding to safety measures put in place to contain the pandemic, such as wearing face masks and keeping physical distancing and regular hand washing using alcohol-based hand and surface sanitizers. Joining me now via Skype is Secretary, Nigerian Medical Association, Lagos Branch, Dr. Ime Okun. Dr. Okun, it's good to have you join us this morning on TVC Breakfast. Now, we have seen, when it comes to the second wave that everyone is scared about, we've seen Israel respond to new infection rates. We've seen Japan, we've seen New Zealand, and some states in the United States as well. What concerns do you have, considering the trend and the way that Nigeria is going?
I'm very worried. Good morning, Mike. Thank you for having me. Hi, Vero. I'm worried because we're having compliance fatigue. Initially, we did a lot of awareness creation, going through community leaders, going through religious leaders to talk to people, because, you know, there's a way people adhere to instruction more when it comes from these influencers in the community. But initially, people were so scared and worried. Of course, we've not seen this before COVID-19, and people were initially adhering to precautions. Along the line, there came that distrust, because along the line, we were seeing cases outside the country or in other places that are more severe, while we had the mild and asymptomatic cases over here. Then the people that were bold enough to come out in the public to talk about their recovery, those that passed through it, were more of the elites and more of the people in the high social class. So people now started saying, okay, maybe COVID doesn't exist because they've not seen people in their own class or people very close to them having it. So all of a sudden, even those preventive measures that people were adhering to initially, people have started being fatigued. They don't do it anymore. And it becomes worrisome, because even the number of cases, the cases that looks as if it's dwindling, is not exactly dwindling or going down like that, because we know we are not testing enough. Yesterday, UNICEF donated some equipment to NCDC, but they kept emphasizing we need to increase awareness at the points. We need to talk more to our people to be responsible. Even if you feel anything about government, you feel responsible to yourself, you feel responsible to your society and to your family. You know, so we need to, it's not yet uhuru.
All right.
So people should not let down their guards at this point.
Dr. Okun, as it is now, international flights have resumed to some countries, have opened, and for some of the first concerns that were raised by members of the Presidential Task Force on COVID-19 were that some persons were coming into the country with fake documents and fake certification that they had tested negative to COVID-19. Do you think that could be a window to the second wave, if at all the proper and adequate care is not taken? Also considering the fact that the first index case in Nigeria in late February was someone who flew in from outside the country.
Sorry, I didn't quite get that.
Do you have concerns that the opening of international flights can open the doors for a second wave?
Okay, so there are measures that have been put in place. So when people are traveling, like 72 hours before you travel, you're supposed to do the test. And when you get to your destination, the test's carried out again. So, and all those guidelines, there are guidelines for airlines and airports and all those procedures. So they have actually put measures in place so that we can avoid importing or exporting of cases this time around. So I'm not too worried because I see a high level of compliance. I've traveled recently, not outside anyways, and I've seen what's happening at the airport. So I'm actually not so worried.
All right. Now, when it comes to the numbers coming down, can we comfortably say that we have flattened the curve and maybe even bringing it down? All right. I guess Dr. Emil Kuhn, we lost the signal from her feed there. All right. She is the secretary of the Nigeria Medical Association, Lagos branch. We've been talking about the concerns around the second wave in the fight against COVID-19. The NCDC, the Presidential Task Force on COVID-19, have all expressed worry and sometimes even frustration that Nigerians are not adhering to the protocols, and that could lead to the second wave. Now, Veronica, I know you were listening to what we were. Okay, I understand Dr. Okun is back now. Let me go back to her before I come to you, Veronica.
No problem.
Now, Dr. Okun, I was asking earlier before your feed went off, can we comfortably say that we have flattened the curve in Nigeria?
No, like I said earlier.
Why not?
Hello?
Because the numbers are coming down. The fact that we're not testing enough, but we see that where the numbers used to be, the numbers have really drastically come down.
Let us err on the side of caution
Okay.
and continue our preventive measures. Use your face mask, Michael. Wash your hands, and if you don't have the facilities to wash your hands readily, use the alcohol-based sanitizer, and let us ensure that we have physical distancing.
All right. Thank you very much, Dr.
All right.
Emil Kuhn, for your time on the program.
Thank you.